Hello everyone, welcome to Let's Talk Anatomy. Today let's talk about the gross anatomy of the temporal bone. We will deal with the temporal bone in two parts. In the first part we'll deal with the squamous, the mastoid, the tympanic and the styloid parts. In part 2 we will deal with the petrous. So let's move and continue with the gross anatomy of the temporal bone. So the temporal bone has a wide variety of functions, and that is why it has got such an irregular structure, making it arguably the most complex bone to study in the body. So it forms a transition between the cranial wall and the cranial base. It houses delicate organs of hearing and balance, and it also forms the upper surface of the temporomandibular joint. And because of all of this, it has got a highly irregular shape. It has a number of articulations in the brain. As you can see, it articulates with the parietal, the occipital, the sphenoid, the zygomatic and the mandible. Now let's go for the side identification. So here we have the right temporal bone, and this is where it is located. Here is the superior, the inferior, the anterior and the posterior poles of the right temporal. The left temporal will obviously be a mirror image. Here we have the left temporal with the same poles on the left side. How to identify the side? First of all, we have to locate the external auditory meatus, which is on the lateral aspect of the temporal bone. With the external auditory meatus facing outwards, the zygomatic process will come anteriorly. The squamous part is the broad plate-like structure which is superiorly oriented, and the mastoid part is the posterior aspect. So this is how we identify the side of the temporal bone. Now let's look at the parts of the temporal bone. The temporal bone has basically 5 parts: the squamous, the mastoid, the petrous, the tympanic and the styloid. The petrous and the mastoid parts are usually combined and known together as the petromastoid. Let's look at each of these parts in detail. So here we have the squamous part. Below and behind that we have the mastoid. Just tilt the bone a little, and on the undersurface, right in front of the external auditory meatus, we have the tympanic part, and the projection from below the tympanic part is the styloid. The styloid is better appreciated from the lateral aspect. As you can see, here you have the styloid process. However, in order to see the petrous part, we have to turn the temporal bone to the medial aspect. This here is the petrous part. I will just place the mastoid right next to it, and then we can appreciate why it is combinedly called the petromastoid part of the temporal. Now let's go on and understand that within the temporal bone there are 4 main canals. The first one is the external acoustic meatus, which carries sounds from outside to the tympanic membrane. The next is the internal acoustic meatus, which transmits the labyrinthine vessels and the cranial nerves 7 and 8. Then of course we have the facial or the fallopian canal within it, which carries the facial nerve, and we have the carotid canal, which transmits the internal carotid artery. Let's see the features of the squamous part. First, let's orient. Here we have the zygomatic process, the external auditory meatus and the mastoid below, and the styloid process. The squamous part of the temporal bone has an upper border, a superior border called the parietal margin, and an antero-inferior border called the sphenoidal margin. There is also a groove for the middle temporal artery, which is a branch of the superficial temporal. This groove lies in that entire space called the temporal fossa, which gives attachment to the temporalis muscle. The temporal fossa is limited inferiorly by this crest, which is the supramastoid crest. But the actual boundary between the squamous part and the mastoid part lies 1.25 centimeters below the supramastoid crest, and this suture is called the squamomastoid suture. The other important landmark here is of course the suprameatal triangle of McEwen, which is a landmark for the mastoid antrum. In adults, the mastoid antrum is seen to lie 12 to 15 millimeters within the suprameatal triangle, while in children this distance is only 2 millimeters, and it increases by a distance of 1 millimeter every year till the adult distance is reached. The suprameatal triangle is here, located immediately above and behind the external acoustic meatus, and it is limited anteriorly by this crest, which is the suprameatal spine or the spine of Henle, which is one way of identifying the suprameatal triangle. Now, two other important landmarks on the external aspect of the squamous part. One of them is a zygomatic process and the other is the mandibular fossa. We'll see both of them one by one. The zygomatic process is located here. It has an anterior end and a posterior end. The anterior end of the zygomatic process is seen to articulate with the zygomatic bone, obviously, with the temporal process of the zygomatic bone. The posterior end, however, attaches to the squamous part by a broad triangular base which has an anterior root, which is here, and a posterior root posteriorly. That is the posterior root of the posterior end of the zygomatic process. Now, the anterior root actually forms the anterior tubercle limiting the mandibular fossa anteriorly, and the posterior root actually has two borders. The superior process or border of the posterior root continues as the mastoid crest, while the inferior border of the posterior root forms the postglenoid tubercle, which limits the movement of the head of the mandible posteriorly. So that is the mandibular fossa, which we'll be seeing next. The mandibular fossa, in order to see the glenoid cavity, we have to tilt the temporal bone a little laterally so that it is a little more clearer. And this is the mandibular or the glenoid fossa. It is divided into two parts, an anterior part which is an articular part formed and contributed by the squamous tympanic bone, squamous temporal bone, and a posterior non-articular part which is here, and that is contributed by the tympanic plate. And these two parts of the mandibular fossa are separated by a suture called the squamo-tympanic suture. So here we have the separation between them. The articular and non-articular parts are separated by the squamo-tympanic fissure. The squamo-tympanic fissure is actually divided into two, a lateral petrotympanic fissure and a medial petrosquamous fissure. There are a few structures passing through the medial end of the petrotympanic fissure, such as the anterior tympanic artery, the anterior ligament of the malleus, and these are located in the petrotympanic fissure. Let's move on and see the inferior or the interior of the squamous part. The squamous part of the temporal bone interiorly is seen to bear the impressions of the temporal lobe. The gyri leave impressions on the interior of the squamous part. Plus, it is marked by the groove for the anterior and posterior divisions of the middle meningeal artery. And there is also an internal beveling of the squamous bone caused by its attachment, squamous part of the temporal bone caused by its attachment to the parietal. Let's move on to the next part, which is the mastoid part, which is located here. The mastoid part has two surfaces, an external and internal, two borders, a parietal and occipital. The superior border is called the parietal margin and the posterior border is called the occipital margin. And of course, it has the mastoid process. Basically, the mastoid part of the temporal bone gives rise to a number of muscle attachments. They are the auricularis posterior. Behind that, we have the occipital part of the occipitofrontalis. Then we have the sternocleidomastoid. Below the sternocleidomastoid, there is the attachment of the splenius capitis. And much below that, we have the attachment of the longissimus capitis. The other important landmark of the mastoid process on its exterior is the mastoid foramen, which is located in this part, close to the posterior occipital margin. This foramen transmits an emissary vein and a meningeal branch of the occipital artery. The emissary vein actually drains the sigmoid sinus to a vein of the posterior auricular plexus. Now let's go for the interior features. Before that, the mastoid process, which is located here. As you all know, the mastoid process is a process caused by the traction of the sternocleidomastoid, and therefore it starts appearing in a child only at around 2 years of age, when the child The strength of the neck muscles becomes stronger. The stronger neck muscles cause pulling of the mastoid and causes the mastoid process to develop. There are two landmarks to be seen on the inside of the mastoid process. One of them is a groove and a notch. The mastoid notch lies immediately inside the mastoid process, and that lodges or gives attachment to the posterior belly of the digastric. Here we have the mastoid notch, and then inner to that we have the mastoid groove, which gives path to the occipital artery. So those are the two landmarks that we see immediately medial to the mastoid process. Now let's look at the interior of the mastoid process. There are two main landmarks here. The major landmark that we see is the curved groove of the sigmoid sinus, and of course, like we mentioned, the mastoid foramen, the inner opening of the mastoid foramen is here because it carries the emissary vein which connects the sigmoid sinus to the posterior auricular veins. Let's look at the tympanic part and the styloid part. In order to look at the tympanic part, we have to turn the bone around and look at it from the lateral aspect. Here we have the tympanic part or the tympanic plate of the temporal bone. Let's zoom in. It has an anterior surface, like we mentioned, that forms a non-articular part of the mandibular fossa, and a posterior surface which forms the anterior wall, the roof, and the floor, and a bit of the the anterior wall, the floor, and a bit of the posterior wall of the bony external acoustic meatus. Apart from this, the tympanic part also has got three borders. The superior border, like we mentioned, is the squamotympanic fissure, which is divided into a lateral petrotympanic part and a medial petrosquamous part. And then we have the inferior border, which actually splits to enclose the styloid process. Lastly, we have the lateral border, which gives attachment to the cartilaginous part of the external acoustic meatus. Lastly, in this section, let us look at the styloid part of the temporal bone, which is this process. Basically, what we have to stress is the styloid apparatus, which consists of all the three muscles which are attached there, as well as the two ligaments. It also has a number of important relations. Laterally, the styloid process is related to the parotid gland. Its base is related to the cranial nerve, the seventh cranial nerve. The tip lies in close proximity to the external carotid artery, and medially it is separated from the internal jugular vein by the attachment of the stylopharyngeus muscle. With that, we come to the end of the first part of the temporal bone. Thank you very much.